Dr. Freda Lewis Hall, Chief Medical Officer of Pfizer, so welcome. We're talking about type 2 diabetes today. Tell us about type 2 diabetes.
It is when the body's blood sugar increases above normal. But diabetes kills more people than breast cancer and HIV/AIDS combined. People with diabetes have twice the risk of having a heart attack and 10 times the risk of losing a lower limb to amputation. In addition to that, it is a leading cause of blindness, kidney failure, to other really serious illnesses like stroke even. So this is a very serious disease.
The only way people are going to not react that way is to educate themselves. This hits close to home because I can tell you I am a type 2 diabetic. And I have been my entire adult life. It's such a lifestyle with me, I don't even think about it anymore. I don't wake up every morning and say, okay, I'm a diabetic, I gotta do this. It's just some of my lifestyle. And so I roll with it. It is just not something you should be ashamed about. I'm not ashamed about it. I'm a type 2 diabetic, there you go, I don't care. I mean, this is what it is, you just live with it.
Some things you can't control, and you said it. There are risk factors for diabetes, your family history, you mentioned that. In addition to that, your age is a risk factor, your ethnicity is a risk factor. But there are a whole host of things that you can control. Your smoking, what you eat every day, when you eat every day, your level of physical activity. Prediabetes is a condition where your blood sugar is higher than normal, but not high enough to be diagnosed with diabetes. And it does not mean that you are absolutely going to get diabetes. You should get checked every year or so. Make sure that you stay close with your healthcare team, have it checked. A full third of the people who have diabetes, a third, do not know it. Some people who are sitting and watching the show right this minute have diabetes or prediabetes and do not know it. I would love for people to go to gethealthystayhealthy.com. Take a look at what the signs and symptoms are of diabetes so that you can educate yourself about that. Go to your healthcare provider and see if you are one of those people that can begin to make some changes to get healthy, just like the two of you are.
I want to thank all of my guests today, especially Dr. Freda Lewis Hall.